to another edition of Neuroimaging Today.
Reporting to you live
from the basement of Humphrey Hall of Queen's University.
So we have a very exciting article to present to you today entitled, Do Vegetative Patients Retain Aspects of Language Comprehension? Evidence from fMRI. So Coleman and colleagues performed this study due to the belief that some vegetative state patients may still have the cognitive ability to comprehend verbal communications, although they lack the motor ability to physically demonstrate this.
There is a growing consensus that the assessment of these patients should include techniques that do not rely on overt motor responses. It is proposed that vegetative state and minimally conscious state patients can retain islands of preserved cognitive function, which are responsive to a variety of stimuli.
The purpose of this study is to determine if there are in fact preserved components of language processing in patients with brain deficit. The goal of this study is to create an optimal diagnosis and rehabilitation tool for the affected patients, as well as provide invaluable information for family and caregivers.
There were 3 groups of patients looked at in this study: patients in a vegetative state, a minimally conscious state, and a severely damaged state.
So what was known before this experiment? A well-known study by Owen and colleagues in 2006 suggested that behavioral observation is failing as a diagnostic tool for language comprehension in vegetative state patients. Their fMRI results detected sustained activity in brain areas, including the supplementary motor cortex in response to verbal commands, which were indistinguishable from the healthy control activations. Essentially, these results show that vegetative state patients may retain the same cognitive functions as healthy individuals, despite not being able to physically demonstrate their comprehension of verbal commands. However, this study used only vegetative state patients, and although the patients demonstrated a cortical response to the speech, the study did not verify their ability to comprehend the meaning of the speech they were responding to.
This study sought to determine whether vegetative state, minimally conscious state, and severely damaged state patients can perceive speech, whether they can differentiate speech from noise, and most importantly, whether they can understand the semantic knowledge being communicated using higher-order cognitive processing. This study was exploratory, and no a priori hypotheses were stated.
14 patients were recruited and underwent a 6-month assessment period during which their consciousness states were classified. Of this 14, 7 were in a vegetative state, 5 were in a minimally conscious state, and 2 were in a severely damaged state. The procedure for the study were as follows. There were 3 sessions. The first session was comparing noise stimuli to silent stimuli. This session was used to determine if patients were responsive to general auditory stimulation.
The second condition in this study was comparing noise stimuli to speech stimuli. This session was used to determine whether the patients could encode the difference between noise and speech.
The third condition was high ambiguity sentences to low ambiguity sentences. Ambiguous words, such as bark and bark, are semantically identical but have entirely different meanings and require additional context for successful comprehension. The third session tested whether patients maintained the higher order processing ability necessary to comprehend the semantic meaning of speech that includes ambiguous words.
In terms of materials and stimuli, the noise condition was auditory noise made with speech frequency levels. The high ambiguity sentences all contained at least 2 ambiguous words. They were matched to a low ambiguity sentence that had the same number of words and same syntax structure, but instead 2 words with no ambiguity. For example, the sentence "there were dates and pears in the fruit bowl" have high ambiguity words versus the sentence "there was beer and cider on the kitchen shelf," which have low ambiguity words. There were 59 items in each of these 3 sessions. This study used a block design where there was 7.4 second silent period that preceded every 1.6 second scan. This ensured that the hemodynamic response would have time to rise and fall.
As for the fMRI procedures, the pre-processing procedures were as follows. Within subject realignment was used to account for head movement noise. Spatial smoothing with a Gaussian kernel of 12 millimeters was used to normalize brain space for averaging results. A general linear model approach was taken for each individual patient within each session. In all cases, a statistical threshold of p is less than 0.05 was applied, then the false discovery rate procedure was used to correct for the multiple comparisons. The individual patient's predicted hemodynamic response, GLM, was matched to the level of noise activation. All of the vegetative state, minimally conscious state, and severely disabled state patients' results were compared to the region of interest analysis of the healthy control group. The healthy control group fMRI analyses showed the expected difference in activation patterns when comparing the noise to silence, noise to speech, and high ambiguity to low ambiguity conditions.
The results were as follows. Participants were classified into 3 groups. Group 1, severely damaged patients. 2 patients were classified as severely disabled at the time of assessment, having emerged from a minimally conscious state. Both of these patients showed a significantly increased activation response when listening to noise stimuli compared to the silent stimuli, and a significantly increased response when listening to the speech stimuli compared to the noise stimuli. For both patients, these responses extended bilaterally along the entire length of the superior temporal lobe, as well as a portion of the left inferior gyrus. The results of the ambiguous versus not ambiguous condition were more variable. Although no results reached significance when corrected for multiple comparisons, the region of interest procedure did reveal increases in activation for the ambiguous sentences in the temporal and frontal lobes.
Group 2, vegetative state and minimally conscious state patients who showed significant responses to both sound and speech. 5 of the patients who had been diagnosed as vegetative and minimally conscious showed significant temporal lobe activation in response to both the noise silence and noise speech conditions. In some patients, their activation looked highly similar to the activation in healthy controls, whereas others showed activation in only one hemisphere. For the ambiguity condition, 3 participants showed some evidence of intact semantic processing, but none of their activations reached corrected statistical significance.
Group 3, no significant auditory responses. 7 of the patients showed no significant activation in response to the silence versus noise condition. While some appropriate neural patterns indicating auditory processing were seen when the stringency of these statistical tests was reduced, their neural activation was either too weak or too varied to be statistically reliable. None of these 7 patients showed significant activation in the 2 higher-level processing conditions. As these results were exploratory, there were no hypotheses to directly support or reject. However, they do support the study's founding theory, which is that some vegetative state patients retain cognitive functions despite an absence of outward behavioral activation. Wow, Aishlyn, that was a lot.
We gotta break that down.
That sure went over my head.
Basically, the most interesting finding of this study is that both vegetative state and minimally conscious state patients showed neural markers of higher order speech processing. The findings of this fMRI study contribute towards a greater understanding of auditory processing and interpretation abilities in patients suffering from brain injuries. Previous research has shown increased blood flow to auditory processing areas during a PET scan in vegetative state, minimally conscious state, and healthy control patients in response to a clicking sound. However, in this study, no higher order processing, as measured by blood flow to the frontal lobe, was found across the 15 vegetative state patients. However, the current findings suggest that in at least a small number of such patients, some cortical integration might be preserved. So, Will, what are the limitations and implications of this study?
Great question, Aish. A positive ambiguity result does not necessarily confirm the successful comprehension of the speech they are presented. fMRI provides only neural correlates of critical functions, and they are thus insufficient to conclude that the participants experienced successful neural processing. Furthermore, fluctuating and impaired wakefulness in these participants may have led to results that would have looked entirely different if they were obtained at a different date or time, as such effects are known to exist even in healthy controls. And yet, with these limitations in mind, the results still indicate that most of the preceding stages of speech processing are intact in some patients and represent at least some sort of attempt at understanding the sentence, even though there is no way to verify whether this attempt led to successful comprehension. These findings also appear to have some significance in terms of the prognosis or retained function of these patients. The 3 patients that showed evidence of higher order speech processing went on to show the most pronounced recoveries at a 6-month follow-up.
The limitations of this study could be addressed by increasing power for the high-level processing condition. For example, by selecting a time course design with longer runs or collaborating with other labs to increase the number of patients available. The wakefulness confound could also be addressed by carefully monitoring the patient's electrophysiology prior to running them and ensuring that they are in a wakeful state.
So, Jessie, what's next in this exciting field of neuroimaging?
On the wider issue of adapting such paradigms for diagnostic use, future studies should aim to replicate these results and compare the findings to pre-existing diagnoses and future prognosis in order to better understand the value of this information.
Thanks for joining us on Neuroimaging today. I'm Aish.
I'm Lillian.
And I'm Jessie.
And we'll see you next time.